Well, I first started having pain in my hip and back and into my knee. And I sought treatment, physical therapy for my back. Then I had a shot in my knee because the back thing was going away, but my knee still hurt. So I had an injection and it was good for maybe 2 months. And then it really came back with a vengeance. And I could no longer work. I had to use a walker or a crutch to get around and really limping. I went to see my family doctor, and he recommended Dr. Duran here at the Nanticoke, and I went over to see him. He had given me the previous injection that lasted a few months, and after he looked at the x-rays and so forth of my knee, he told me I needed to get a partial knee replacement, which is replacing about half your knee. And it is my right knee. And from there, we went on. He scheduled it about 3 weeks to a month later. And that allowed me to still do exercises at home to keep my strength in there, because I didn't want to lose the strength and make my recovery, as easy as possible. And then we went to a camp or a session about a week before they did the knee surgery. And there they explained what was going to take place, what they were going to do, and then I'd be staying overnight and things of that sort, which made the transition and the stay in the hospital was going to be very short. I spoke to one of the volunteers downstairs that directs you to where to go, and she told me that Dr. Duran was a very nice person, and I said, I don't think this will be much of a problem. She says, that's like all men say. They say, we just come in, get a knee, and go right out the next day. She told me, but it's not that way for most people. So from then on, I went up and everything went very good. Nanticoke had a lot of people to care for you, let you know what was going on. They'd come in and take your blood pressure and the medications that I was taking at home. They brought them right to me there at the bed, make sure that I had everything and everything was going fine. And the people, the anesthesiologist and Dr. Duran come in and saw me, and so I knew what to expect and approximately how long it would take. To express it to my wife and my other family members that were there. And from there it went, had I believe it was a spinal injection, which I had that before, but it didn't take long at all. And then the next thing you know, you're upstairs in your bed, your knee is wrapped up, and you've got enough pain medication that really it wasn't bad. And while you're there, the first few hours or half a day, they had like an air balloon around your knee and leg and so forth, so that made sure you wouldn't get any blood clots and things like that. And then the following probably morning is when I was able to get up, go to the restroom, and walk with a walker. And then they had a little session before we left to make sure that we were lined up to get physical therapy. And you want to make sure you get a good physical therapy department like they have at Mears, the Nanticoke. And I think the physical therapy started within, a few days of when I left the hospital. The only pain medication that I needed when I came home was Tylenol and aspirin. And that's all I used from there, and for the next probably a few weeks, that's what I used, Tylenol and aspirin. And The only discomfort I had was it would be a little bit uncomfortable to sleep at night to get in a good position, but my wife gave me a pillow to put between my knees so that I wouldn't put pressure on my knee at night, and that helped me, and from there it was all good. If anybody was going to get their knee replacement, the Mako system was very good. It fitted me terrific. It allows them to do no more work than they need to prepare your knee. Some of the other companies, I think, have various size knees, and they sort of hand fit it and that kind of thing, but the Mako system gets everything set up so there's no more work on your knee than what needs to be done. And the fit was excellent. Even the physical therapy department was amazed how good it was when it came out, and the range of motion that I was able to get right away. I'd recommend it to anybody that's going to get it done. And Dr. Duran is a terrific doctor.